Good afternoon, everybody. I'm Hoa. I replace Thuy in presentation. And today is so happy to share with you the nationwide expansion of MCH Handbook in Vietnam. And first of all, I would like to introduce Vietnam, our country, which I hope many of you have been in Vietnam, and you can see Vietnam is a long country with population is more than 90 million. We have children under 6, around 7 million. And each year we have around 2,200,000 pregnant women and almost 1.6 babies also born. Given this number, help to estimate how many MCH handbook each year we have to prepare to meet the demand. Regarding the progress of implementation in Vietnam, we have experienced 4 phases: starting, piloting, and advocating for expansion. And now we have already expanded to almost all the provinces in Vietnam. For starting point, MCH Handbook was first used in 2004 in Bến Tre province. It's one province in the south, including in the project supported by Japan for disabled children. In 2006, there was an international workshop on MCH Handbook in Bến Tre, and some leaders from municipality was invited. And soon after that, they realized the important roles of the MCH Handbook in improving mother and child health. So that's why from 2006, we have participation of municipality, and they participated in some implementation in some other provinces. However, it's actually locally, is not including in the national program or plan. In 2011, with companionship from Madame Bando, we received the project from JICA for piloting MCH Handbook in 4 provinces, 2 in the mountainous area in the north, 1 in the central, and another in the south. After 3 years of the trial, we are finalizing MCH Handbook for Vietnam, and we are so happy to know that all the community, family love to use MCH Handbook. And using MCH Handbook to improve mother knowledge, attitudes, and practice on antenatal care, and using MCH Handbook to help people to daily care of children and when they get ill. Using MCH Handbook also support for API nutrition programs. And having evidence based on the improving mother and child healthcare from provinces, and also learn experiences from international conference, we do a lot of, we have done a lot of activities for mobilize fund to have more provinces to implement the MCH Handbook. And we also summarize the MCH Handbook content and put it in the national guidelines for reproductive health care. That document is legal and used for the whole country. We also organize some national workshops on MCH Handbook to introduce MCH Handbook and to share experiences and to confirm benefit of using MCH Handbook. And we consider using MCH Handbook as a text in primary healthcare systems. One key factor is a policy support. We advocate for support from policy, and we succeed in this. Municipality already issues a decision 140. It's to make all the provinces have a favorable condition to implement the MCH Handbook. We have a compulsory part for all the provinces to do it, and we also allow the provinces to add the more content if they think it's necessary for their areas. We also, in the decision from Minister of Health, also required the related branches, the other department, to involve in using MCH Handbook, especially in the kindergarten. We guide the teachers and people who take care of the children how to use it, to monitor mental growth development of children, and record all information related to health of children. Very recently, we Ministry of Health issued the decision for electronic version of MCH Handbook, and soon in future we will put the MCH Handbook electronic version into the universal health record system, both clinical management information and preventive information management systems. In the decision, we also very clearly specifies for the role at central level. It means Ministry of Health and also provincial levels. Ministry of Health have a responsible for replacing all the tools related to MCH Handbook, MCH monitoring, like a medical book, pregnancy checkup, immunization card into MCH Handbook, and also support some conducting training, develop electric version, and on the important role is a mobilize resources for strengthen MCH Handbook implementation, and at local responsibility, they direct to guide the health staff and family how to use the MCH Handbook. And also in each province, they have a very detailed clearly for responsibility. For example, provincial people committee, Department of Health, Control Disease Center, health facility, and community health center. In summary, the success of to expansion of MCH Handbook in Vietnam, I think thanks to 4 main keys. First, MCH Handbook is by itself is very clearly beneficial for mother, children, community, and health staff. And we have the enthusiasm of medical staff at all levels, especially at the grassroots level. And important factors is the policy support. And at last is not least, but not least, is the companies with and support from UN, international and national organizations, NGOs, and companies. So I would like also to take this opportunity, thank you your own to have been supporting Ministry of Health to successful in expansion of MCH Handbook, and do hope that you still continue with us in strengthening and keep the own activities going on. I finished my presentation with a photo of the conference of promotion of the use of maternal and child health handbook. We can see the man in the middle. He's a Vice Minister of Health. He's present in the workshop to show the commitment and support from Ministry of Health. And so also his present give more energy for staff from all the provinces to implement MCH Handbook in their areas. Thank you very much for your attention.